Okay, my name is Natalia Loera, and this is my pathogen project. I did tetanus and actinomycosis. So, pathogen descriptions. Tetanus is a bacterial infection, also known as lockjaw, and it attacks the nervous system. The typical causative agent of tetanus is Clostridium tetani. Clostridium tetani is a gram-positive bacilli species that forms endospores, and these bacteria are motile and have flagella all around the rod-shaped cell. Actinomycosis is a rare chronic bacterial infection that attacks soft skin tissue. It's also known as lumpy jaw. And the typical causative agent of actinomycosis is the bacteria Actinomyces israelii. Actinomyces israelii is a gram-positive bacilli species. They are filamentous and arranged in chains. Clostridium tetani causes tetanus, and tetanus can be contracted through contact with the bacteria via open wounds and enters the body through minor abrasions. So think splinters of metal, wood, and even thorns. But also like if you cut yourself on like a rusty nail or barbed wire, things like that. And once infected, tetanus itself cannot be transmitted from one person to another. The route of transmission for actinomycosis. So Actinomyces israelii is found naturally in mucous membranes of the human body. So places like the throat, intestinal tract, vagina. This bacterium is only harmful when it begins growing in places of the body where it doesn't belong. And the displacement of Actinomyces israelii is typically caused by surgical infections, so like oral surgeries and diseases like gum disease. So signs and symptoms and progression if untreated for tetanus. So tetanus, like I said, is lockjaw. It's also called lockjaw because that is one of the main signs that one has tetanus. Also difficulty breathing, swallowing, drooling, neck stiffness, and muscle spasms. And if untreated, tetanus can cause laryngospasms, which is tightening of the vocal cords, can cause fractures and broken bones, pulmonary embolism, which is blockage in the lungs from blood clot, aspiration pneumonia, which is infection from inhalation of spit or vomit, and even death. Possible signs and symptoms of actinomycosis and progression if untreated. So it should be noted that symptoms of actinomycosis depend on where in the body the infection is occurring. So some common signs and symptoms are fever, fluid-filled bumps on the jaw, face, and neck, or inside the mouth, which is why it's also known as lumpy jaw, and pain when chewing. If left untreated, actinomycosis will spread to other areas of the body, cause necrosis, which is tissue death, cause osteomyelitis, which is bone infection or destruction, and even organ failure. Available treatments for tetanus. So patients with tetanus should be administered a dose of human tetanus immune globulin, which is also known as TIG, as soon as possible. And once TIG is received, sedation medications can be given, and these will be used to help calm muscle spasms. They have an anesthetic agent. The wound site should also be thoroughly cleaned. So wherever the bacteria entered the body, so if you got a splinter in your foot, or you stepped on a rusty nail, or you were cut by barbed wire, wherever that cut is should be cleaned thoroughly. Any debris left over from the puncture should be cleaned out, and also if it's to the point where the tissue is necrotic, that tissue should be removed. Once cleaned, antibiotics like penicillin and others could be used to help rid the body of infection. And pregnant women may receive magnesium sulfate to help prevent muscle spasms. It should also be understood that patients diagnosed and treated for tetanus are able to and should receive the DTaP vaccine as soon as they are in stable condition. So available treatments for actinomycosis. Actinomycosis may be treated with prolonged use of antibiotics. The most common antibiotics used are penicillin G, beta-lactams with oral amoxicillin, or cephalosporin. Allergy substitutions may be used if necessary. There's a list of them right there. In some severe cases, both antibiotics and surgery are necessary to remove the infection. Prevention of tetanus. So the most effective preventative measure against tetanus is vaccination. As I stated before, the DTaP vaccine is the vaccine that it helps prevent tetanus. It also helps prevent diphtheria and pertussis, so it's like a 3-in-1. And DTaP can be given to children as young as 2 months old, and then should be administered again at 4, 6, between 15 and 18 months, and once more when a child enters school, so like 4 to 6 years old. And the last DTaP vaccine as an adolescent should be received at the ages of 11 or 12. And adults having grown up taking the vaccine should get a booster every 10 years, but if you are an adult and you have not received the DTaP vaccine growing up, you should get a regular dose and then boosters as necessary after your first dose. While there is no vaccine to help prevent against actinomycosis, there are other preventative measures that can be taken. The most effective way to prevent actinomycosis is to practice good oral hygiene. So brush your teeth, floss your teeth, go to your regular dental checkups to get your teeth cleaned, and restrict alcohol intake. Prevalence of the pathogen. So tetanus mortality rates have significantly decreased in first world countries, so places like here in the United States, but still there is an unproportionate prevalence of this infection in low-income, low-resource settings. In 1997, it was estimated that there were around 275 deaths from tetanus, around 275,000 deaths from tetanus around the world. And in 2011, there were approximately 14,132 cases. In the United States, it's common to see tetanus in elderly people due to decreasing immunity, and it's also common to see this infection in drug and alcohol-dependent people. The decline in tetanus infection is largely related to the popularity of the DTaP vaccination campaign. It helped encourage populations across the world to properly protect themselves and their children. So continuing with tetanus. Tetanus is an infection that is more likely to be contracted in third world countries, specifically sub-Saharan Africa and South Asia. Environmental factors like climate, temperature, and sanitation make these regions a perfect place for Clostridium tetani to flourish. A study conducted in 2017 by the Global Disease Burden found that 82% of tetanus cases and 77% of tetanus deaths worldwide were reported from South Asia and sub-Saharan Africa. A lack of adequate resources is another component that plays a role in the prevalence of tetanus in the developing world. Many clinics in these low-income, low-resource areas do not have the proper technologies for critical care, like ventilators, and they also don't provide affordable care for average income or below average income families. This is a little map of the global impact of tetanus from 1990 to 2019. So figure A up at the top shows the ASIR, which is the age standardized incident rate. And in the middle, you have changes from 1990 to 2019. And so 2019 is in green and 1990 is in red. And then C is the EAPC, which is the annual percentage change. So there's that. Prevalence of the pathogen. So actinomycosis. Actinomycosis does not have any regional or racial correlation, but gender does seem to play a role in its prevalence. The occurrence of this disease is more common among men between the ages of 20 and 60 years of age, with peak contraction between 40 and 50 years old. There is a 3-to-1 ratio of men to women, and about 60% of cases are cervical facial actinomycosis, lumpy jaw. So actinomycosis is a bacterial infection that can be caused by poor dental hygiene, so things like gum disease, which is oftentimes attributed to drug and alcohol abuse, which is more common in men than women, and so we can conclude that this is one reason actinomycosis is more prevalent in men. So a recent outbreak of tetanus happened in 2005 after a tsunami hit Indonesia. It was discovered that there was a tetanus epidemic in the survivors of the disaster. There were 106 reported cases. 79% of the people were over the age of 25. 62% were male, and there was a 19% mortality rate. And this led to the conclusion that disaster relief support efforts should include supplies like vaccination and treatment for tetanus. A case study of actinomycosis. So this was done on a 48-year-old man who experienced a growth along with sharp pain in the back left area of his mouth following the extraction of his left molar 2 years prior. No fluid or discharge was reported. And a biopsy confirmed granulation tissue. Granulation tissue is connective tissue that's found during healing processes. A CT scan showed that a soft tissue lesion was compromising the left maxillary sinus, which is found in the cheekbone region. And the upper left maxillary premolars and first molar were then removed, along with tissue from the lesion, and it was concluded that the mass was a non-cancerous tumor that became infected with a secondary infection of actinomycosis, and antibiotics were administered for 3 months, and the patient had been declared asymptomatic for 2 years following that surgery. An interesting fact about tetanus is that if one contracts the infection, it doesn't make them immune, so the number one successful way to stay protected against tetanus is to receive a vaccine. And actinomycosis was originally thought to be a fungal infection due to its filamentous nature. It resembled fungal structures, but it's actually bacterial. I'm really sorry about that. I don't know how to turn that noise off. And last but not least, my questions. So, true or false, actinomyces is found naturally in the human body. 2, what age can the DTaP vaccine be given to a child? What other name is tetanus sometimes called, and what other name is actinomycosis sometimes called? And these are just my references.